Okay, so we've started recording. We'll get moving. So as I said, I'm Carrie Sykes. I am the Health Inequalities Lead within the Children and Young People's team in the Learning Disability and Autism Directorate at NHS England and Improvement. And I'm joined by Anna Timmins, who is the Learning Disability Support Manager at Morecambe Bay CCG. The layout of the session is going to be kind of who we are, why we're here, and what we want to achieve out of the session. Anna's going to take you through a piece of work that she led in Morecambe around how they've been relatively successful with it. In fact, not even relatively, they've been very successful with this piece of work. And then there's going to be a discussion session at the end. We're going to have 3 questions that will hopefully generate some questions, some helpful kind of suggestions, and some areas that we at NHS England can focus on in terms of what do we need to put in place to help you to be able to increase the uptake of annual health checks for children and young people. And then again, there'll be further opportunities for questions and answers. So I'm going to hand you over to Anna, and she can take you through the Morecambe Bay approach.
Super. So I'm Anna Timmins, and I'm the Learning Disabilities Commissioning Support Manager for Morecambe Bay CCG. And we were awarded the exemplar back in, I think it was November 20, at the height of the pandemic, which wasn't great timing. But our focus was on children and young people and increasing the number of annual health checks for them. Just want to pop to the next slide. We did lots of other things within our project, but obviously just for today, I'm just going to focus on the 14 to 17-year-olds. If you go to the next slide. We picked children and young people purely for the fact that in our area, the uptake of annual health checks was really, really poor for those aged 14 to 17. And what we also knew is that at the time we'd only got 98 14 to 17-year-olds on our GPLD registers. And doing a sort of quick sort of number count from the number of children in our special schools, we knew that we were quite far off in terms of those people that were on the GPLD registers. If you go to the next slide. So probably a couple of points to sort of bring up, which will hopefully sort of start the discussion, is we got we've managed to do it both now for Cumbria and Lancashire, because we cover 2 areas, to include the annual health checks in their Year 9 review. So what we mean by that is we've designed a postcard and we've designed a leaflet for children and young people. So this is to essentially let them know about annual health checks. The postcard is for them to take into their GP and ask their GP if they're on the GPLD register and if they can have an annual health check. So at the beginning, this was just done in South Cumbria, but this has now gone across to Lancashire as well. And it's been really, really well received. We've also managed to get in sort of all of our sort of promotional material in the paperwork. And we've also managed to get it in with paediatricians. So we can sort of try and link up every time the children sort of see a professional within that sort of Year 9 area, that we're sort of capturing them all. What we also did in our area, just in South Cumbria to start with, is we got a list of all of the children that have got an EHCP due to a learning difficulty. And because we sort of had funding attached to the exemplar project, our annual health check coordinator was able to sort of take some time to go through all of the data to identify children that potentially had a learning disability that needed to be on a GPLD register. I'm sure you've come across it before, but there's issues with different professionals using different wording. So within the EHCP standard agenda, it's referred a lot to as learning difficulties. And obviously to get someone onto an LD register, you need a diagnosis of learning disability. So we'd already got an existing neurodevelopment pathway group within South Cumbria. So for those children that hadn't got a clear learning disability diagnosis, they were sent their sort of paperwork, their case was sent to this neuro group, of which we'd got psychiatrists, paediatricians, DCOs, children's learning disabilities nurses, to see as a collective if they knew this child, if they could come to a conclusion that it's most likely that this child did have a learning disability. And if they could, then a letter was written to the GP to say that they'd been seen at the neurodevelopment group. Our paediatricians and psychiatrists in the south of our county have also agreed to use the word learning disability within their paperwork. So if it's very clear cut, we're not asking them to diagnose, but if it's very clear cut that that child does have a learning disability, that they use that within clinic letters. And then the last part to sort of what we did is we've got some money left at the end of the exemplar. So our very keen children's learning disabilities nurses have set up a workshop, and we've got lots of promotional material. And this is to go out to special schools and promote the annual health check. It's also sort of been done in conjunction with sort of desensitisation work. So if a child is struggling, having their blood pressure taken or being weighed, measured, all of that equipment goes out with the nurses to these workshops. And the children at the end of it then go home with a pack for themselves and then a pack for parents to let parents know why we need annual health checks. And then the other part, which I'll just briefly touch on, which we need to carry forward as an area, is there was a parent survey looking at the reason that parents struggle to take their children to annual health checks. So we've got a lot of soft data from that. We had 45 responses, and we're trying to tinker with our GP training. A lot of it was about GPs not understanding the case, not understanding the child, and basic learning disability and autism awareness. Do you want to go on to the next slide? So this just shows, just for the south of the county, we'd actually managed to add another 50 children to our GPLD register, which is a phenomenal success. And the other part of our area, which is Lancashire, it's taken a bit more work because we're doing it as a complete ICS, and we're having a bit more difficulty with the data sharing. But we're getting there, so we sort of roll it across Lancashire, and how we're going to do that year on year. Do you want to go to the next slide? So this was just our good practice example, just of obviously of how many children that we added to the GPLD register. And I think it's what we tried to do is we've tried to approach it from every angle. So it is mentioned in the EHCP paperwork. We are targeting paediatricians, psychiatrists, parents to share the learning as to why it's so important at the age of 14 to start these annual health checks, because when we get to transition, we want that really good relationship with the GP already established. So we thought if we approach it from all angles that we'd get a better result. Next slide. So the recommendations from our exemplar is we've asked that we need a health facilitation team within our area, and hopefully we've managed to secure funding for that, because we have recognised the fact that someone needs to work on this ongoing, not just as a 12-month pilot, and that we're going to look for perhaps nurses in each of our ICPs once they get developed, and they'll be able to further look at the work as to the barriers that parents are facing into bringing their children in for an annual health check. So this will sort of be going forward across Lancashire and South Cumbria as an ICS, to keep sort of the pressure on to make sure that, you know, all of the children are attending. And that is it from me.
Brilliant, thanks Anna. I'm going to stop presenting because I know that I think a couple of questions popped up in the chat, but then that we can ask other questions or answer other questions before we move on to the bigger discussion part. So let me just have a look in the chat. So we've got a question from Sarah Morton. And Sarah was asking, in Morecambe, did you use any learning disability screening tools? For example, the Disability Matters one or any other tool during the process?
We did for adults, so that's a standard process for our adults. And we thought it needed just a bit more sort of work, hence the sort of taking them to the neurodevelopment group for children. So that's the sort of approach that we've taken. But yeah, we use it when they get to 18. We've used the learning disability screening tool.
Brilliant. And I've got a hand up with Sarah Tilton.
Hi, thanks. Yeah, it was just to say that it's my understanding they don't need a formal diagnosis of learning disability. So I know in a lot of areas, including ours, the problem in getting one, you get global developmental delay delivered when they're a baby, and it very often doesn't get changed. It's better where I am now, but the NHSE have produced a whole list of read codes that make young people almost certainly eligible and possibly eligible for the LD register. Even if they're not. And Sarah Childs had a very useful thing that they were looking at in Bromley of sort of questions to ask young people, like things like, do they tell the time? Can they tell the time? Can they, go to a shop and do things like that to get a level of function, I guess, to decide whether a young person has a learning disability if you can't get down that formal diagnostic route.
Yeah, because there was a group of children at the end of our piece of work that it didn't feel right to that a diagnosis was appropriate at that time.
Yeah.
So the new codes that have been released, the SNOMED codes, will be really, really helpful, and it's sort of it's trying to empower our GPs to sort of say we know there's issues in the wording and the diagnostic process across the country. It's not just ours, but these children can be added to the GPLD register, and they will totally, the annual health check will be beneficial for them.
Yeah, because you can't just interchange difficulty and disability.
No,
it's not the same thing. So, although I did have one child that got on the register because somebody accidentally wrote disability once instead of difficulty, so it was down on their record that they had one. But I've tried to embed both in Buckinghamshire and in Cornwall, embed the LD register as part of the usual questioning for the EHC needs assessment and for annual reviews. It's easier said than done because schools don't like starting conversations about things they don't feel they completely understand themselves. But obviously a lot of these young people are in special schools anyway, so it's a question of building relationships with the special schools and getting it as part of everyday talk, really. Young people
and making sure that there's that health representation if needed at the EHCP reviews, which I think has been lacking in our area. I know that.
Yeah. And it's easier in Cornwall where they've got a very robust special school nurse situation, but where you've got schools that are outsourcing their special school nursing and all sorts of dodgy stuff going on, it makes it much harder.
It does.
Thank you.
Thanks, Sarah. We've got a question as well from Anne Foreman from North Tyneside CCG, and they're asking, do you have any plans to align EHCP reviews with LAC reviews?
Ideally, that would be great, wouldn't it? That would be really, really good. And again, I think South Cumbria will be the area to sort of start that for us, and that's the plan, because when we did the questionnaire in terms of what are the barriers to parents getting their children to their annual health checks, it was just like they attend so many reviews, they attend so many appointments, they fill out so much paperwork. So if there's something, so we did a nice little helpful sort of questionnaire for them to fill out and take to their GP, but naively I was just giving them more work to do even though I thought it would be helpful for them. I was just giving the parent more work to do. So any way that we can sort of reduce the amount of appointments and pressure on parents, and obviously try and get that sort of collective approach would be excellent.
Oh, another hand has just gone up, and that is, I think, Sarah Childs from Bromley.
Hi Anna, it sounds like an amazing piece of work that you've done. So congratulations, that's outstanding. I'm just being, it's probably a cheeky question, because I've just shared the questionnaire tool that we've just done in Bromley, and I just wondered if you would share your postcard.
Oh, absolutely. And yeah, we'll send the Word version as well as the PDF version. So please just take our logo off, put your logo on, and use it. So yeah, if we can, I'll send you the sort of things that we did throughout the project, so you can. We've done leaflets and easy read, this, that, and GP support packs, all sorts. So yeah, please use what you can.
That's really generous of you. Thank you so much. I've popped my email address in the chat.
Brilliant.
Thanks, Sarah. Any more questions at this point from anyone? Oh, hang on, we've got another hand. Let's see who that is. Oh, it's Anne Foreman.
Hi,
Hi,
sorry.
Anne.
Just, did you mention, have you worked with the Send Youth Forum, or what kind of participation and engagement activities with the young people? Because I know you mentioned a survey to families, but have the young people been involved in this as well, did you say?
Yeah, so we went to one of the special schools with all of what we were designing, and we also went to a couple of the young people's day centres. So those that are just a bit older, we went to one of our colleges to ask them what we're doing right, what we're doing wrong, and just to sort of get a feel really in terms of what they would want. What we did get actually, which I haven't put anywhere, is they were very much indicating that they would like a range of ways to contact their GP, of which we don't offer in our area, to be honest with you. If you want a GP appointment, you phone, and you know, if you want an appointment, you have to phone at 8 o'clock. And so they were saying for the annual health check reviews and things like that, they definitely want other options to contact the GP, whether that's emailing an administrator or things like that. But it's taken this sort of soft information, isn't it, and getting the GP practices to make that change, because you may end up with an extra 10 that you're able to do per practice.
Brilliant. I can see there's been a couple of people asking in the chat about the sharing of resources. Yeah. So what I'll do is Anna can pull that together, and if Anna forwards it to me, I'll send it across to Tamara at the CDC, and then CDC will be able to get that out to everybody that had signed up for the workshop. So you will receive a pack of those.
Super.
I'm going to put slides back on the screen, and then this latter part of this workshop, we've got a series of 3 questions that we're going to put to you and open the floor to you as a group, to hopefully get you thinking on how this might work or otherwise in your area, and what kind of support we at NHSE would be able to give you around this. So I'm going to just put those back on the screen. If you give me 1 second. So thinking about, if you just take kind of a minute or two to think about how would this approach or a similar approach work in your local area, and just really, I suppose, opening up the floor, is there anything similar currently happening in other areas that anybody would like to share? Sarah Childs.
Hi, I'm quite happy to share. I can't claim to have got anywhere near as far as Morecambe Bay have. We too have a challenge around the diagnosis, and it's a conversation that we haven't managed to shift yet. So we felt that our special schools needed to have information embedded in their annual review training around annual reviews. And then we need to think about mainstream schools where they're not sure about the diagnosis, to support them to have conversations with families and know what information to tell your GP when they are thinking about whether or not you're eligible. So what Sarah Tilston was just referring to was a easy read questionnaire that we've put together. Now, it's not a screening questionnaire. It's a list of questions that you would hope the GP would be asking in order to decide upon eligibility. And rather than just hope the GP is going to ask them, we wanted to develop the materials to enable families to come already equipped with the answers and then tell their GP. So we're trying to embed that questionnaire into the use of annual reviews as well. And I think from listening to what's just been spoken about, I think I really need to start working with our special school nurses because they're really open and up for this. And I think our community paediatricians, for various different reasons, I think aren't ready at the moment to kind of have those conversations due to various different things, but not something to be forgotten. I think we need to make sure it's on the agenda for us to consider. So we're on a similar journey. We're just not as successful as Morecambe Bay. And I've shared the questionnaire. It's in the chat.
Brilliant, thank you. And we've got Sarah, is it Sarah Tilston again?
Yeah, again. It was just to say that I had I'm going to try much more with my special school nurses, because I had a conversation with our LD nurses that we've got in Cornwall that are doing an amazing job at promoting the register, talking to GP practices about it and everything, but they only go down to 18. So getting that cohort for 14 to 17-year-old is harder because there isn't anyone that does children's. They just do adults, but they do work with the practices around it. And they were very sweet. They said, well, you know, it's because it's not big numbers. If I have young people at that age that need raising when they're meeting the GPs about the 18s and overs, they'd be able to do it. But it is frustrating. They seem to have things, you know, well in place for the older ones. But I don't know how other people feel about data as well, because it's really hard to get the data in Bucks. I had it sus that they provided me with the 14 to 25 data for LD register young people, and the uptake was really good. We hit all our targets, but it's all pigeonholed to 14 to 17s or 14 up to 18 and then 18 to 100 or whatever. Mm-hmm. And trying to find out what the uptake is for the 18 to 25s is much harder. You get people sort of saying manual count at you. Oh, no, they don't collect it. It'd be nice if it was asked for when they do the data. It'd be better because of the reforms was so long ago now. We can't call them new. They should be collecting the data up to 25s. The other thing I was going to ask about, whether you know about the data, because I've been encouraging practices to put under 14s on the register as soon as they know a child definitely has a learning disability. But I've been told by the LD nurses that would skew the data, because there might be X number of children on the register that aren't eligible for an annual health check or whatever. So they weren't keen, but I've always promoted it for any age.
And we would promote it for any age, yeah, because they can pull the figures out. The eligibility is based on 14 to 17-year-olds or 18 to 24 or kind of over 18. So it shouldn't skew the data at all if you've got younger children on the register.
Okay, that's good to know. Thank you.
We would definitely support. Get them on the register. Don't wait until they're 14 and then.
Yeah, I did see a GP register once that had add to register in 2032 written on it, on this toddler with a very obvious learning disability. So it was on the plan, you know, as soon as they hit 14, they were getting on that register, but it did make me laugh.
And in terms of the data, I know that the data that I can look at via NHSE does split the age group into 14 to 17 and 18 to 25. So I'm not sure how to then get that split further per region, but it's obviously, it is something that they can do, but I'll see what we can find out at this end.
That would be great, thanks. And I'll try again this end. People always say to me, Oh, I just collect it. I can't do anything like that with it. So, thank you.
That's fine. I can see further up the chat that we've got Jane Dunlop. Jane, you were going to kind of let us know a little bit about what's happening in Devon. Is that okay?
Yep, I can do that.
Brilliant.
Can you hear me?
Yep.
Yeah.
Yep.
So I'm one of the community paediatricians in Devon. I'm also the DMO. And so I have a clinical interest as well as a DMO interest in learning disability. So I've kind of made it a bit of a hobby horse, I think, over the last year. And what we did was we wrote a kind of toolkit where we started creating a toolkit of what a learning disability was, because what happened was that it came out of this what's a difficulty and what's a disability discussion at the SEND board meetings, and we were going round and round in circles. So we wrote a toolkit, but as part of that we got all the everybody that we could think of who would come in contact with a person with learning disability to start collating what kind of ordinary assessments they were already doing that would provide information towards a diagnosis. So what are the OTs doing that helps us with adaptive functioning? What are the educational psychologists doing that could help us with cognitive functioning? All that kind of thing. And we had what are the social workers doing when they're, you know, in their preparing for adulthood checks that would help us understand about their level of functioning. And we've collated all of that into a toolkit for Devon, which the sort of little aim at the beginning was that we'd have enough information when we'd done that toolkit to make the diagnosis. So we've ended up with kind of 3 streams. We've ended up with a group who are clearly not learning disability, a group who are clearly are learning disability, and then this group in the middle that need further workup. And so I'm endeavouring to have more clarity about a learning disability pathway, diagnostic pathway, which is echoed across the whole country, I know, but I think it's been very helpful to just raise the conversation about it being everybody's business working towards the diagnosis. It's not something that you can just expect a paediatrician or a GP or a psychiatrist or a psychologist to do on their own. It has to be done in a joined up way in order to find the evidence to make that diagnosis. And the evidence is really out there if we can just pull it together. And that's the aim of the pro forma. And it's quite a clunky thing and we need a lot of work doing on it. But at the same time, we had some funding from the Burdett Trust Fund, who funded the learning disability nurses to do a project exactly about linking it up with annual health checks and co-production and with special schools and post-16 providers. And what it's come around to is that we need to really work on the year 9 reviews as a key place to focus that energy, and also perhaps to focus the diagnostic timing. So we're going to try and extend our project a bit to do that. And I think the other thing that has happened is that we've tried to try and find these children and young people for their vaccinations, their COVID vaccinations. So that's also focused everyone's minds on finding people. Where are our cohort with learning disability and how do we access them? And using the names from the education healthcare plans and doing that data share that was, you know, for which we could do for vaccination was really useful. So I think data sharing, that would be my main message back to the NHS England, is how we get stuck unless we have that easily doable. And now I'm saying, can I have the names of the people back who had vaccines so I can write to them and get them on the learning disability register? They're telling me no, that's not what it was sent for. So I'm like, okay, I give up, you know, because that's just bonkers, So that would be my plea, that we could just get this data sharing better, please. So I hope that helps.
Yep, that's really helpful. So I'm aware we've got about 10 minutes left, so I'm going to show you the next 2 questions together. And then if anybody's got any comments, you can comment on either of the questions. So kind of leading on from question 1, it's thinking about how would you be able to support or facilitate an approach like this in your local area? and what could you kind of take away to implement? And then thinking on a wider scale about influencing local policy and pathways to kind of how do we get the discussion around annual health checks taking place within EHCP reviews. And as you say, kind of Jane, within things like the vaccination programme, having that sharing. So if anybody has any kind of comment on that, that would be brilliant. So I'm just looking in the chat. I can see Kirsty Greenwell in northeastern North Cumbria. Are you able to kind of give us a bit of a verbal update on that as well there, Kirsty, please, if that's okay?
Yeah, that's fine. It's a really broad tool. So at the minute we're having a lot of challenge around diagnosis-led services, because this is across into adults as well, and needs-led. So obviously to get access to a lot of services, you need that. But really the system can't cope with that. So we've developed this classification tool, and it's just, you know, it's person with a mild learning disability, person with a moderate learning disability, and person with a profound and multiple learning disability. And it just gives a really broad general overview of how that person might present, just to give that GP a bit of confidence to add them to the register, because I guess it's the same what Anna was saying. Getting your annual health check is beneficial, and being on the register is beneficial, even if they don't have that diagnosis.
Yeah.
But I'm happy to share that.
That would be brilliant. Yes, please, Kirsty. And I can see Anne Foreman from Tyneside again, talking about targeting specific practices. Are you happy to speak again, Anne?
Yeah, that's fine. So we were originally in a position where we'd had very little data on 14 upwards. And so there was a lot of work done behind the scenes to be able to capture that. And so we're now able to track them through primary care as well as into our acute settings. Those within the education health and care plan, and we have a full action plan. I'm sure everybody has, purely on addressing the uptake, but we are also emphasising it's not just about the uptake, it's about the experience. If you have one poor annual health check experience as a young person or as a parent and carer, then you're probably not going to be inclined to come back, and you've lost your chance. So we are trying to work with our primary care colleagues to make sure that they do understand. We had an example where I'd spoken to our Send Youth Forum about annual health checks, and we had some sort of interactive fun, and then one young person went away and had their annual health check, and the GP said, well, I don't know why you're here. What do you want? What do you need? You seem fit and well. And it was an absolute failure. So, we have identified that we need to support our colleagues in primary care to appreciate and understand what we need of them, as well as parents and carers and young people themselves being able to identify that. And just I mentioned there that one of our primary care networks has invested in a young person's learning disability coordinator. So part of his role is to support parents and carers and young people in a variety of ways to take the opportunity and understand what an annual health check is. So we'll watch and wait and see the impact on that.
Would you mind sharing the job description for that with me?
I don't have that personally, but I will try and grab it for you. But that was one. I basically met with the primary care network and said, it's very lovely that you've got one for adults, but what about our young people? And they said, oh yeah, good point. So there was a bit of a push, and he's fairly new in post, but yeah, I'll try.
That would be lovely. Thank you.
Please.
And has anybody else got any kind of further questions or comments? We are in the last couple of minutes of the session, so if anybody has got any burning desire. Oh, Adeline, am I pronouncing that correctly? Adeline Gibbs?
It's Adeline, DCO for Oxfordshire. I think for me, I'm very much in that sort of ICB kind of state of mind, as I'm sure many of my colleagues are, and I'm just wondering if anybody had any thoughts or any progress on how they then upscale that in an ICS footprint. I'm just asking for, you know, any ideas from this group, really.
What we're hoping to do within Lancs and South Cumbria is, obviously with the health facilitation team that we're hoping to recruit to, is the people that will be based in practices based in the ICPs won't necessarily be a learning disability nurse, because we just haven't got enough of them. However, the above the sort of nurses that are going to be sort of practice based or on the ground is then going to be supported then by people that have got learning disability and or autism experience to try and upskill those people, just to sort of say, you know, you might not have a learning disability degree, but you know, you can be more than capable to do this job, to help these parents, to help these people access their annual health checks. Because we were very aware when we were sort of writing the job descriptions that we're asking for another 5 or 6 learning disability nurses in our area that we just haven't got. So our plan is to upskill existing members of staff, practice nurses, general nurses, mental health nurses that have taken an interest in wanting to do this work within learning disabilities and annual health checks.
Thanks, Anna. So that brings us to the end of the session. I've got my email in the chat. If anybody's got any kind of questions or kind of thinks of something after the meeting that you want to discuss or raise, please do feel free to drop me an email. I'm generally around, and I'd be happy to hear from people. And a big thank you really to Anna Timmins, letting us know again kind of what worked well in Morecambe, and thank you all for contributing and for sharing the resources as well. And as I say, we will pull together the resources from Anna, and I will also pull together the ones that have been linked in the chat so that everything goes out at one time, and we'll get Tamara can kind of help circulate that to all the attendees today. So thank you all very much.
Thank you.